Hey, this is Neil. I'm a former fellow, current attending at Northwestern. Just wanted to say a couple things about the body fellowship there. In short, it's awesome. Highly recommend it. A couple important things I think about for fellowship are the training, the work environment, your work-life balance, and then job prospects. So in terms of training, I think big thing is volume. We have a ton of volume at Northwestern, especially one awesome thing about this program is there's a lot of MRI to do. You'll be doing MRI over 50% of the time that you're on service, and there's no shortage of MR to read. I think pretty much all of us, regardless of where we're coming from residency, we all got a lot of ultrasound and like a lot of CT. So the thing you want to fill out in fellowship is getting more comfortable with MRI, and you'll get a lot of that at Northwestern. You'll get, especially like you'll get advanced MR too, like post-procedural livers and prostates, and regardless of whether you go on to academic or private practice, that's something you'll be able to bring to whatever practice you go to as your subspecialty body training. And then the other part of training is the attendings that are teaching you. We have a lot of awesome attendings. Our section head is Frank Miller. He has something like, it's like 350 PubMed publications or something like that, like a lot. And he's very active in teaching, and we have many other awesome attendings that are very knowledgeable, like leaders in their field, and all of them, like every single last one of them, are pretty involved in teaching and take teaching pretty seriously. And that kind of, it also with these attendings, kind of getting into the work environment, it's very relaxed. You know, it's not like Dr. Miller, Dr. Horowitz, it's Frank and Jean. And that's true for most of the attendings. It's just like very casual, very collegial. It's kind of a nice place to go into work. And in terms of work-life balance, I think the call schedule is very reasonable. It's a good balance between like you have enough call that you actually have responsibility and you're getting ready to be an independent radiologist like attending, but not so much that it like crushes you and you're going to get burnt out over the year. The other thing in terms of work-life balance, for those of you not familiar with Chicago, it's an awesome place to live, whether that's just for 1 year as a fellow or whether you're thinking of putting down roots in the Chicagoland area. And then in terms of job prospects, honestly, it's a great job market right now. You're probably, all of you watching this, are going to do just fine in terms of finding a job. But it certainly doesn't hurt to have connections coming out of fellowship. And we're a pretty big program. We've got a big alumni network. We have like 8 fellows a year. So you can imagine we've got a lot of former fellows all over, especially if you are looking to practice in the Midwest. Then we have a lot of regional connections, but we also have national ones too. So yeah, I could go on and on and on, but that's my short version of things about the program, and it's a great place.